Great, thank you. My name's Ethan Baldwin. I'm a policy analyst with the Division of Financial Regulation, and this is our rate review consumer-friendly summary document rulemaking advisory committee. That is a mouthful. Maybe the first agenda item should be getting that shortened, but yeah, so we'll go ahead and start with introductions. We'll start with DFR staff, and then we can move to everyone else.
I guess I'll go. Tasha Sizemore, Life and Health Product Regulation Manager with the division, and my team includes the folks who review rates.
And I'm Jesse O'Brien. I'm the policy manager with the division.
And I'm Karen Winkle, the rules coordinator for the division.
All right, thank you. Now we'll go to, let's go with the members who are on the RAC, and then we can do interested parties after that. I'm sorry, Antoinette, that was a little faint for me.
Oh, I didn't say anything yet. I was trying to. I'll go first. Hi, my name is Antoinette Iwachi, and I'm the Senior Public and Regulatory Affairs for Cambria Health. And we have the plans of Regents Blue Cross Blue Shield of Oregon, as well as the Bridgespan health plans. Thank you. And I'm a RAC member.
Thank you.
Hey, I'm Tara Harrison with Providence Health Plan and also a RAC member.
I think I'm on the RAC. Rick Blackwell with Pacific Source Health Plans.
Yes, you are.
And this is Courtney Johnston with Health Net of Oregon.
And this is David Liebert, Senior Director of Actuarial with Kaiser.
Hi, this is Katie Button. I am the Plan Management Policy Analyst for the Oregon Health Insurance Marketplace.
All right, do we have anyone else who, I guess that's all the RAC, so let's go to anyone else, interested parties, members of the public.
Hi, this is Merlene Converse, and I'm a government relations consultant for Kaiser Permanente.
All right, do we have anyone else who has not introduced themselves? All right, great. Well, we'll just jump into it. So a little background. I'm sure most of you know why you're here, but House Bill 2564 was a bill run by the division to improve parts of the rate review process, to streamline it, reduce some redundancies, and also added a part that would give or direct DCBS or DFR to, by rule, create the form and manner for a consumer-friendly summary document to be submitted with rate filings. So that is the purpose of our RAC meeting here today. So in the agenda items we sent out, internally, so we'd have some starting points. We threw around a few ideas of items that would potentially be useful to consumers in a consumer-friendly summary document. Additionally, we also sent around an example of what Washington State does for the same kind of purpose. So we can go ahead. There's kind of a few ways we can go about this, but I think the first real question that DFR had, And this may be more for our carrier side, but also just in general, what we think consumers would be, what would be most useful is, would it make more sense for the rule that we draft to be a list of items in the rule text that all companies submit a document with these items? Or would it make more sense to write a brief rule that pointed to an exhibit, and then we could update the exhibit when we needed to make changes? The benefit of an exhibit would be that it would be an apples to apples where everything looked the same. You know, we could create a template and then it would just be kind of plug and play. And then it would be a pretty easy comparison, but just wanted to start there maybe and see what members of the RAC thought with the idea of a list within the rule text versus directing towards an exhibit.
I guess can I ask? Sorry, wasn't sure if you want us to jump in.
Yeah, absolutely.
Okay. My first question is just, what do you think the process, or what would you anticipate the process for updating the exhibit would be if that was the direction you were headed?
Well, so I don't necessarily know that we would update this every year. It would kind of just depend, on bandwidth as well as what we're seeing from consumers. If it's a useful document, if there's information that would be more useful, if there's stuff that we don't need, it would just kind of depend. It would be a year by year decision. As far as updating it, the example that I would use would be like our standard health benefit plans, where the rule text is pretty bland. It just kind of says, see exhibit, whatever, for the standard bronze and silver benefits. And then the exhibit is just, in this case, it's a PDF with all the benefits that are required for those plans. And then when we make changes to that, it's just the exhibits on our website, and that's how we update it. All right, Rick, I saw your hand.
Thank you. I don't know that I have a preference as to exhibit or rule text, given the fact that you'd have to go through a rulemaking process no matter what. But I want to back up a little bit and ask the question of, this is a bill that DCBS had filed through the governor. I'm curious as to what your interpretation of the statutory text is, because I'm trying to figure out, are we supposed to be writing something consumer-friendly summary that's constrained by the rate filing that we file under this section? Or is DCBS reading this more expansively, that it may just be part of the filing, but it could be whatever the agency chooses in its discretion to require?
No, yeah, I think, and Jesse and Tasha can correct me if I'm wrong, but our interpretation and our goal with this was to make something that would summarize rate filings, so that, they're in some cases, multiple hundreds of pages of pretty in-depth actuarial information. And the idea would be that it'd be nice if a consumer could just look at this document to kind of get an idea of what is changing with the rates for their plan, and kind of the impact and what's driving that rate change, et cetera. So it'd be more specific to the rate filings and less kind of, global, I think. And yeah, Tasha's chiming in with what is changing with the rates and the plans.
So Ethan, this is David from Kaiser, and so I've got experience, way too many years experience with both filing in Oregon and Washington, and I know that like the feds already have a document. It's called the Part 2 document, which is supposed to be a consumer friendly exhibit, and it is not. They give a list of all the things that should be in it, and every carrier interprets it differently. They're very hard to read. They're not consumer friendly. I would not advise going down the same path as the feds. But I kind of like the idea of something that's a little more of a hybrid, where you do have a template, but like right now on our rate filings, we do have exhibits that we have to submit. But if there's little tweaks that we need to make to them to make them make sense, we have some freedom to do that. And I kind of like that idea that you have a template, but if you need to tweak something just a little bit, you can do that. But you'd have a list of things that that cannot be missing from the template.
Okay, so kind of a little bit of both. Yeah. All right, Tara. Yeah.
Yeah, I think if we're looking at what's going to help consumers the most, a template where, to the point, right, there's a little bit of flexibility with it, but it has a lot of cohesion carrier to carrier, so that consumers can look at it and digest the information more easily. That makes a lot of sense. From a carrier perspective, the notion of kind of updating ad hoc makes me a little bit nervous on what those timelines are going to look like. If we put something in rule that kind of aligned to those timelines with when you're releasing information in early January about kind of anticipated filings and those things, so that we're kind of prepared if there are any changes, that would be helpful. And then if there's substantive changes to content, that would go through a more substantive process than just kind of rolling out a new template. Yeah, that's my feedback.
Yeah, definitely. To that point, this would not be something that we would kind of do at the last minute. It would be something where we've identified maybe some information that would be useful or some changes that could be made, and we would give ourselves adequate time. As it is, we wish we had more time this go around, but with when the bill was enrolled and when we need to get everything done for the effective date, we are kind of up against it. But in general, we do like to hopefully give ourselves and everyone enough time to get things implemented. Antoinette, I saw your hand.
Yeah, so I am liking what my other counterparts and other health plans have been saying. And also as being part of the RAC for the standard plans, I really do like the exhibit idea, but of course I need to consult with my actuaries first to see the approach that's also good for the consumer as well as, of course, the carrier. But if we go the exhibit route, and again, as being part of the RAC member on the standard health plans, and I think as Tara also mentioned, that would require some advanced preparation on the DFR's part in terms of making sure that if there are any changes to the exhibit, which I'm assuming it will be the template kind of route that my other counterpart, I think in Kaiser had mentioned, so that at least with the template, it's just apples to apples, origin story. It's the same for every carrier. It's just that the carrier will put in your specific information, unique to them in that. But obviously, if we go with the exhibit route, similar to the standard health plans, of course, it would require some advanced, planning on the DFR's part in making sure that the rulemaking is done in advance before our actuaries actually start the planning phase for the rate filing. So I think that should be, considered as well. But I am leaning towards more of the exhibit, but of course it's subject to what my actuaries would prefer that my company does. So that's my input for now. Thank you.
Sure. Yeah. No, thank you. That makes sense. And yeah, any changes we were going to make, we would definitely, go through the robust rulemaking process. It would not just, because like Rick said, either way, we're going to have to open the rule if we want to make any changes. So we would go through
exactly.
So it wouldn't be the kind of thing where one day you would see that the template was changed, or the exhibit was changed and no one knew why, and now there were new requirements. So rest assured, there would be the full rulemaking process. Tara, is your hand still up or is it freshly up?
I appreciate the distinction. No, it's still up. I'll lower.
Okay, thank you. All right, so that's given us a lot to think about. So with that in mind, let's go, while we're doing that discussion, let's look at the Washington example, and we can also kind of take into account the doc ideas that we sent. But has everyone had a chance to look at this? What are thoughts on the kind of information, how it's presented? This is kind of, obviously we would tweak it, but this is a kind of an idea of like a template exhibit sort of thing that we were looking at. So what are thoughts on this one specifically? Anyone have any, or is it just, yeah, this looks clean, this looks nice, or it doesn't get there, or?
Little questions. If I wanted to pull them out, and maybe we could send you something, but I look at something like people impacted. I don't know. Are they trying to say members, or are they meaning a broader population, potential members who would sign up for that health plan? I don't know. There are little things here and there, right? But if we're looking at kind of broad feedback about format, I think that this is pretty easy to read and digestible. I don't have concerns with it for format.
Yeah, and to your first point, with the people impacted, I'm not sure if people had time to see the email from the our other RAC member, Robert Anier, where he cited that as potentially problematic. As is this all the people who are covered under the plan, including dependents, or is it specifically just the enrolled member or like the policy holder? So that stuff like that would need more clarification, but yeah, so the format is easy to read, clean. Okay, anyone else have thoughts? Katie, yeah.
The only thing that I saw on this that I thought might be confusing for folks, and this might be more particular to us here in Oregon, was this particular carrier is a for-profit carrier, looks like, because they had like a profit line. But I think we only have one carrier or maybe two that are for-profit. And so I don't know if we would, and this is a question for the carriers because I don't know if we would maybe want them to add a little bit of information about a nonprofit versus a for-profit carrier.
Okay.
Stole my comment, Katie.
Okay. Okay.
No, I agree with Katie. I noticed but we have a margin that we manage to, but we don't have a profit in that sense. And I think that could be, it might be nice to be clarified. I also noticed this particular template talks about how we plan to spend premium. I mean, we have to spend the premium on claims, right? And we do have some administration that's required to do that. I don't know if it's this isn't fully discretionary, I guess is my point.
Mm-hmm. Okay. All right. David, yeah.
So this is, I don't know who puts this together for Washington. It's not the carriers. At least I have never seen this document. I've been filing there for 25 years. So yeah, I think it is a little confusing. I'm sorry, I don't remember who just made the comments, but like the premiums and the claims, that looks like that is historic because it says January 2024 to December 2024. But that's a little confusing, but I do think that they do hit on a lot of the important information. But it's just I definitely wouldn't just copy this over line for line. It's a very, I find it to be a confusing document.
Okay. So yeah, I don't think we were thinking copying it directly over as much as one, just the general layout, how it looks. Is it easy to read? As far as formatting, less about whether it's confusing. And then, does it capture a lot of things that would be useful to consumers? But yeah, we would do our own kind of exhibit template, similar to something like this, but tweaked here and there. Antoinette.
Yeah, I should say that this is actually one of our affiliates, the Assurance Northwest plan, of our Washington plan. I don't do that plan or line of business, so don't know much details about this. And my actuary, who I could have asked, is out of the office today. Um, just for, I guess, our next RAC, if there is going to be a next RAC, is it possible to obviously provide feedback in terms of what may be more beneficial to the consumer here in Oregon? Because again, Ethan, as you said, this is not going to be a copy over and then us use it for Oregon. But I would like the opportunity to work with my actuaries to see, certain aspects of this document, which would be beneficial in providing more of a consumer-friendly one in Oregon. Because again, as some already noted, there are portions of this that really may not be applicable here in Oregon. And I'd like for the opportunity to kind of weed through that and provide our comments on what could work here in Oregon for the consumer.
Sure. Yeah. So to one of your points, yes, I would expect we'll have another meeting. We have one on the books right now for, I want to say September 4th. So about a month out, a little less than that. So yeah, we'll have time for comments and feedback, and we can, kind of do some background before that. But I would expect that we'll have that meeting unless somehow we can magically come to something in between now and then. So let's transition a little bit to less of the content on this and look kind of at the list that DFR sent out. This is one that we discussed internally among some of the people who are involved in rate review. And this is kind of information that we think is both extremely useful to consumers, and in many cases, it's stuff that is either already submitted or probably isn't too hard. Obviously, company name, website, and customer service details would be pretty straightforward. The service area, we were thinking some sort of visual would be really useful, because I know in that example with Washington, it's listed, but a lot of people are more visual. What do people think about that item, or about these first two items? I guess we'll go through.
This is Courtney Johnson. I guess I'll just say I think both of those look fine to me.
Okay, and that's great. I mean, the easier, the better. We're not trying to reinvent the wheel. So then we do want to break down, or we're thinking a breakdown of the rate request. And Tasha might be able to speak a little bit more to this, but it would have, the percentage for trend, for legislative, and for uncertainty. Tasha, are you able to provide any more detail there?
Yeah, so this is in part what is reported. Who is it? Exhibit 5, maybe. I can't remember the exact exhibit, but this would be a breakdown of the rate request by the 5 categories, I think it is, that are in the rate filing. And then how much of the rate request is toward legislative changes. That is frequently a question that we get. I think insurers, especially the actuaries, will know we have started to ask for that in a little bit more detail. And then percent for uncertainty. And once again, that is something that we have in the last couple of years incorporated into the standard questions that we send out to all of the insurers. But just breaking that down for consumers so that they can see what we sort of put together internally in the spreadsheet. I don't know if that makes sense, especially to the actuaries. We call it the trend and spend component of those categories. So hopefully that helps a little.
Yes, Antoinette.
Yeah, so quick question. Of course, I don't have my actuaries here and I could ask, but I think Tasha, you can answer this. So with the dollar amount and percent, you want both, or is it one or the other?
I would probably say both at this point. I would look to the actuaries to from all the companies to maybe give us feedback on if there's one or another that your organization feels is more useful. I think it's for us, we look at them in a variety of ways. I don't know exactly. I don't think consumers care so much about the percent. They're probably more interested in the PMPM, but I don't know. Right now, looking for both, but also open to feedback.
All right, David. Yeah.
I was thinking, Tasha, I was thinking kind of along the same lines you were when you first started out, that a lot of this information is already available in the filing. So it's not like we're having to recreate the wheel. We're just having to display it differently. And I'm all for that. It's Exhibit 3. I was thinking Exhibit 1, but it's Exhibit 3. So
thank you.
But yeah, one of the things I look at, it's like you put in dollars, then you have to define, well, what's the dollar based on? Is it the average premium? It's real tricky because somebody who's age 21 on the cheapest plan, or somebody who's age 63 on the most expensive plan, those dollar amounts could be 5 times different. So but the percentages are pretty similar, plan to plan and age to age. So there is that trickiness to it. Not saying that we can't do either. I mean, we'll do whatever you ask of us. But I just wanted to point that out. It is a little tricky once you get into the dollars. What do you define the dollar off of? And then you'd always have to have that statement. This is not true for everybody, because it wouldn't be true for everybody.
That's very correct. Yeah.
All right. Thank you, Tasha. We'll go down to the next item. And this one is a breakdown of retained premium and MLR for the last 3 years. Any thoughts on those items as items? Okay.
We already filed those, and
Okay.
Again, kind of like the last one, we already filed those. So converting those into a new document, or translating them into a new document, I don't think should be difficult, and it's not recreating the wheel. So I would give it my thumbs up.
Great. The next item, how to access information in other languages. Thoughts on that one? Okay, and next one is something that so I see 2 hands. Let's go. And I think I saw yours first, and then Rick will go with you next.
Okay, so quick question again. I don't have my actuary here. So is that information something we currently file in the rate filings?
Which one?
How to access, the information in other languages.
So as part, I don't think that it is expressly in the rate filings. I don't have my actuaries
You
here
do.
either. But I don't think it is explicitly in the rate filings, but as part of the federal requirements around access, there is a translation requirement that insurers have, and how I think Jesse, Ethan, and I had maybe envisioned this is like a QR code that you can scan that, or that somebody could scan that takes the person to the other translated documents. I think that would probably suffice. But I don't think that there is anything currently that is rate review related, relating to translation that goes into the current filing.
Okay, so it would be something new to this. Okay. Thank you.
Thank you. Rick, yeah.
Sorry, my mouse is terrible. Well, I mean, effectively, you're asking us to translate these then in other languages. In the proposed bullet would do so. I mean, I think at the very minimum, this would have to be reflected in the statement of need, right? That this is going to cost so much for carriers to do this. Yeah, I mean, I think that's probably, I think it's a little beyond what the statute seemed to contemplate, but so I'm a little concerned about this one.
Yeah, Rick beat me to the hand raise. We have a similar concern. That's a new burden to put on carriers and not an inexpensive one. And I think it's outside of what the legislation kind of reviewed when it talked about creating these consumer-facing documents. I think the federal requirement for this pertains to different types of materials, and we meet those standards, but this would be something above and beyond those.
Okay. David, yeah.
And this is what it made me think, that at that point this would have to be a template and just a fill in the blanks, and so the translations could already be an additional template that's basically just converts our inputs into other documents for us.
Okay. Antoinette.
Yeah, that's a great point, David, an idea. Again, and then I agree with Rick and Tara too. It appears that it goes beyond what's required, by the underlying legislation. But and an alternative to this is, what David was saying. I guess like a template that's already translated for carriers, and we just put in the necessary unique information for that health plan. I think, David, that's what you were essentially trying to say, right?
Yeah.
Okay, so that's all good feedback. So yeah, we'll take all of that under advisement. And obviously we'll also accept any written feedback going forward. So the next item we had was executive compensation. Now, this one is one that we weren't, the way that we had presented it in the past, I'm not sure if people have been around for a long time or not. David, I think you'll probably remember this, but in our old days, we used to have a consumer-friendly decision document at the end of rate review for each filing. And in that, our financial regulation folks would pull the top 10% or top 10 executives and like what the PMPM or what they made PMPM. So what the impact was. So this is an item that we get a lot of feedback and questions about from consumers, and we were just wanting to kind of address that. So this one's a little more open to what maybe the RAC thinks is a good way to present this. What would be the best way to make it apples to apples, especially, Jesse, yeah, go ahead. Save me from myself.
Oh, I don't mean to interrupt. I was just planning on appending something to what you said, so you can finish up first.
I think that was about where I was at. So yeah, please do.
Yeah, I was just going to say, this is, I think, probably the number one single thing that we get the most questions about from consumers in connection with the rate review process. And I think when the accurate information about executive compensation and its role in its basically non-existent role in rates is put out there, it could help perhaps clarify what's really going on here. And some of you on the call are aware that prior to working for DCBS, I worked for several years for the consumer group Osperg that was very involved as a kind of consumer representative in the rate review process. And I can say from working with kind of grassroots consumer constituencies that were interested in commenting on rate filings, this was the number one thing I heard about from everyone. And it was occasionally a little bit frustrating in as much as, I think this isn't really the thing to be concerned about in the context of rising health insurance rates. But, I think getting real information out there about this could be illuminating and help people focus on what's really going on more effectively. And we do also already receive this information just in other contexts.
Yeah, that was much more succinctly and adequately explained. So yeah, Rick.
You might, despite my background as being at DCBS, I feel like this information is maybe a little bit misleading and sensationalist if it was placed out there without an understanding of how medical loss ratio works and how we're constrained in what, we're spending 85% at least of premiums on care. The rest of it is for administration and then, of course, profit or margin, right? So I don't know I think it might actually distract from the point of what we're legally required to spend money on and what that looks like.
Okay. Tara.
Yeah, this one surprised me a little bit to see it on your list. And so I circled with my actuary before jumping on here. And he said that there's a broader category in the filing about wages and salaries, but that it isn't quite an executive comp category. And so it is outside of what we do for rate filings now, as I understand. I do worry about creating targets when the information is shared in this context and without the broader kind of context and understanding that Rick just already spoke to, and I'll echo that. So it doesn't feel like the right place for this, but this does feel like the right place to talk about, some of what we saw in the Washington document about what are your admin expenses, what percentage of the premium is anticipated to go towards medical claims, those things where that compensation rolls into one of the categories that gets shared, but it's not a line item where somebody is misunderstanding and looking at a particular CEO and having ideas that we've seen in the last year play out in really negative and dangerous ways.
Yeah,
sure. And real quick, that is the target idea is one that we discussed, and I think if we were to do something with this, it would be aggregated. It wouldn't be specific to any one individual. And that's typically how it was in the past when we did have that kind of information. It was an aggregated total. It wasn't, this person makes this much, this person makes that much. But that item is one, yes, that we also take very seriously. Antoinette.
Yeah, so I agree 100% with what Tara said. Seems to be very targeted, and I think we need to be very cautious with that. But isn't these list of stuff that each carrier would have to submit? So with respect to the executive compensation, how are we going to, I guess, we provide that information as part of a consumer friendly document, but you just said that it's going to be aggregated. So I guess I don't understand. Yeah,
Sorry.
where it's actually going to go.
No, so it would be aggregate. So like the way we did it in the past, and again, this is not necessarily how it would need to be done, but in the past when we would release it, it would say, for Regent's individual filing, here's the decision we reached. And one item that people talk about is executive compensation. And for the top, percentage of executives or top 10 executives, whatever, it's this much PMPM, something like that. So it was aggregated amongst the individual company, but there are no specific people called out, if that makes sense. There were no specific salaries either, like attuned or aligned with one person. So it wasn't any one person made this much money, or the vice president who's unnamed made this much money. There was nothing that level of specificity within the information we released.
Okay, so with this required information list, is that something that would be included in the exhibit? I just want to make sure I understand. It's like if we go the exhibit route, is that something that'll be specified in the exhibit?
Yeah, so right now these are the ideas we came up with. And the original question was, would it be more useful to just in the rule put text like this, where we said, each consumer-friendly document must include company name, must include website, must include bullet point, versus each consumer-friendly document will follow the exhibit, or must fill in the exhibit, see exhibit 5 or whatever, and then that exhibit would have these categories or these fields that you would then take the exhibit and fill it out yourselves for what the company is. I mean, that was one potential plan, or those are a couple of the paths that we could do. We could also do one that every document must include these items at a minimum, see exhibit whatever for how it should be formatted. This is kind of why we're having this meeting, is to get to that place.
Yeah, so if we're going the exhibit route, and upon just what I'm hearing, that it just doesn't seem of have an executive compensation here, and knowing that the information is essentially will be aggregated, it just doesn't make sense in the exhibit. If the DFR wants to collect it separately and aggregate that for consumer information elsewhere, then I think that makes sense. But on the exhibit itself, again, upon what I'm hearing, it just doesn't make sense to have it on here. But again, I will, okay, I'll get my actuary's input too. Go ahead, Jesse, I'm done.
I think I think the use of the term aggregation is confusing the issue, because we're not talking about aggregating it across the entire market. We're just saying that the number would be across the entire company that was reporting. So it wouldn't identify individuals or their positions within the company.
Yeah, okay. I'll take it back to my actuary, but again, supporting what Tara said, and then in addition, I don't really. I know the DFR did mention that that's the question that the DFR gets the most from consumers. But again, I think we need to be very careful in terms of where that information goes in here. But again, I'll get my actuary's input and then provide comments on it. Thank you.
Yeah, thank you. Sorry for the confusion. Thank you for the clarification, Jesse. Katie.
I think that it would be good to talk more about MLR and and show, because I think I haven't looked at MLR in a while, but I believe that all of us, excuse me, all of you are up over 90%. And so it might be helpful to show MLR versus like national averages or even like averages of other states near us, because I think that the real story is that carriers are spending the money on claims. And so if you're interested in knowing what they're spending their money on, you want to see how much money they're spending on claims. So I think for a consumer perspective, being able to show them more about what MLR is and how well our carriers are doing on MLR helps them see better what carriers are spending their money on. And then when you can see that the total cost of their all of their employees are included in that admin cost, and that admin cost is such a small percentage of what they're actually spending on. I think that's the real story, and less on what their executive compensation is, especially because we as a state don't have any real, ability to affect their executive compensation. And that's not our job to tell them what to pay their executives. It is our job to make sure that carriers are spending their money appropriately and that they have enough in reserves and whatnot. And so I think, again, showing the consumers what MLR means and how well our carriers are doing on that is the better story to be telling there.
Sure, that makes sense. All right, so yeah, we've got a lot of good information about the executive compensation, so we'll take that back. And then the last one is some sort of changes to networks. This is another one that we get a lot of questions about, and I'm not sure if people saw the email again from Mr. Anir. That was one that he's flagged as a consumer that is really important to him. So what are thoughts on changes to network? And no, we don't specifically have an idea in mind of what that would look like. That's kind of maybe an idea here of if we want to go forward, how that would look, or what would be the most apples to apples way to present that information.
Isn't that already a part of the rate? Oh, I'm sorry. I forgot to raise my hand. I am so
Oh, no.
sorry.
Come on,
Go
Elizabeth.
Isn't that already required in the rate filing? Because I know in preparation for our rate filings, that question comes up and we make sure it's addressed. But I thought that was already required in the rate filings.
So some of this information, as Dave has pointed out, is stuff that is already submitted. And it's just, again, these filings are quite complex and quite large. And a lot of it is information that your teams are already submitting, and it's just pulled out into one document so that it's consumers to see. So yeah, potentially I'll ask Tasha to speak to whether or not how the changes to network are presented, or maybe David, you have some information on that.
Well,
I'll just go ahead. Go ahead.
No,
Go ahead.
Okay, I'll go. I was actually going to ask what is meant by changes in networks. I mean, Kaiser has it probably the easiest thing to do, because we always have changes to our networks where, we may add an outside clinic or we may remove an outside clinic, but we don't have major changes. We don't move plans from one network to another, because we don't have two networks. We have a single network. So we have it the easiest, but I'd wonder what is meant by changes, because as I said, there's always little changes that happen. And I don't think that that's really what you're looking for.
Because if it's something that we are currently including in the rate filings, and it's just a matter of also just moving it over to this consumer-friendly document, then, great. But is it something beyond what we're currently submitting? It would be great to know.
Yeah, there's a couple of things that come to mind when I think of changes to networks and how they're filed in rates. I'm going to use some real life examples, and I don't mean to pick on any of the carriers for this, but these are just changes that have happened over the years, and they stuck with me. So we have a couple of insurers, Moda with the Beacon network, and Oh my goodness, there was two or three other networks a couple of years ago, and they have pared down the number of networks that they have in their portfolio. So that would be an option. Kaiser, I know that you have the added choice kind of distinction coming in. That would be something that just kind of talking about more broadly, we would be looking for. Um, if you're making big changes to like not allow out of state services anymore, in line with what Pacific Source is doing for 2026. Those are the big changes that we're looking for. We did talk internally about major hospital changes, or if like a pharmacy chain were to go off network at some point. But oftentimes those type of individual facility changes or provider changes don't really align very well with our rate filing. So we are really looking for the bigger changes to be outlined in this particular document. And Antoinette, to your point, it is in there, but it's not in a very consumer friendly way. So hopefully that answers that.
Yes. So I'll go. I think I saw Rick and then Tara and then Antoinette.
Yeah, I mean, I think Antoinette kind of asked my question, but I'm trying to determine what level of information, or I guess maybe the bigger question is, are you asking for network changes to networks that could materially impact premiums? So like, I mean, Pacific Source, I guess, is the example. Moving to an EPO might change, right, materially what premiums look like. I think disclosing like every doctor or hospital that may or may not be in networks difficult to forecast given how negotiations go.
Exactly. I think you hit it right on the head. I think, and unfortunately, Pacific Source is the timely example right now because it does really demonstrate why the rates are so different this year. But I do think that it would be something that would impact rates or trigger like a modification discontinuation notice to consumers. Like if it's going to knock the consumer into needing to make a plan decision or having a plan decision made for them because it changes the network, that would also be something to put in this document. And once again, that's filed elsewhere and stuff. So they would just be combining it into this consumer-friendly document.
All right, Tara.
Yeah, thank you. I think that the details really matter on this one because this category is so broad. I think that's what we've all kind of been hitting on as we've been discussing. There's information in there. There's information that we've shared, I think, at least the last 2 years when I've been overseeing our consumer and regulator facing presentations with the rate hearing, where we like to share kind of what are the changes to plans. But at the same time, if we're putting this in a very consumer-friendly document, I don't like to have a lot of legalese there, but this is one where I would want to ensure that we have a caveat that's consistent, that kind of makes the public aware that networks are dynamic, right? They can change between now and over the course of that next year after they sign up for that health plan, depending on how contract negotiation goes. And so we need something there that kind of ensures that they're not seeing this as a guarantee. And then when, you know, Tasha, to your point of like, we want to hit the big stuff, but we don't need all the little ticky stuff. We need clear guidance, I think, as an industry to know what that line looks like so that we're all submitting the same kind of level of information. Because I think it's harder to compare apples to apples if we're all interpreting that requirement differently. So yeah, those are my thoughts there. This one, I see the value for the consumers. I just want to make sure that what we're sharing with them is understood correctly. I think that's where I'm going with it.
Yeah, definitely. Antoinette.
Yeah, and this is just being a little maybe nitpicky, but more on the cosmetic end than anything else. And I think for us, we may have notified or included in our rate filings. And again, I can't confirm this, but like for example, changes to the network names, is that something you're looking for? Because I mean, I'm glad that you clarified that anything that would actually impact, the rates, it's what you're looking more towards a change to networks. But for example, change in network names, is that something that you would you're also looking to fall under this umbrella of changes to networks?
Let me think about that, Antoinette. That is kind of a weird distinction because it wouldn't necessarily impact rates in that case.
Correct.
But consumers might be interested to know of a change. So let us take that one back. I don't have a great answer for you on that. And maybe if insurers want to provide feedback one way or another so we can consider it, I'd be willing to consider feedback from insurers on that point. Very much. And
yeah. Go ahead, Antoinette.
Yeah, and again, I was just, throwing out that example, not necessarily to say that let us include it, but just throwing that example because I know the question may come up. So, okay, great. Thank you.
Yeah, and David, I see your hand, so I'm going to jump to you next. But real quick, I do want to reiterate, this is not the end all be all. Like, we'll take written comments offline after this, on the entire list, on the entire idea, everything, format, how we do the rule, everything. So, yeah, David.
Yeah, and I'm going to say something. Maybe I'm stepping in something that maybe even my own team would get angry at me for. But I kind of think that maybe not just changes to networks, but just descriptions of networks, because I think that's where if a consumer doesn't know what the network means to begin with, it doesn't really matter what the change is. And so that's where I think that it might be good to have just like a 2-line description of each network that a carrier is using, or 1 line, just something.
Your colleagues from all the other carriers are gonna beat up on you next time they see you. That ultimately that is one of the things that we were looking at long term, is like, how could we expand it long term to include something like a description or something like that, but also recognizing that that's a lift for all of the insurers to go directly to that kind of additional information level, because that is not something that we have necessarily asked insurers for in the same way in the past. So happy to take that back, but just so folks know that is something that we discussed, but it might be kind of a longer term thing, not this year. So you might be off the hook, David.
All right. So that kind of runs us through the list, as well as kind of our talking points. So I guess the last thing I'll say right now is, as far as the list and the format, before we go to public comment, we would like feedback. We will plan on meeting again. I think that meeting is September 4th. And then if necessary, we can meet again after that. We do kind of start running out of time to get this effective for January 1. But with that being said, I'll open it up for any public comment right now. All right. Hearing none. Oh, Rick, yes.
I know I'm not quite public. I did want to raise some concern though about I guess the preliminary decisions portion of House Bill 2564. I know we can't change any of it. I am a little interested to see how the department is going to move forward now that some of the more APA terms of calling a preliminary decision a proposed order has been integrated into that provision of law. If your intent is to keep it the same as keep the process the same as before, or we have to rush to the mini courtrooms here in Salem.
Well, that is that I'm not sure. And that's not really envisioned within this rule. So I'll leave that for Tasha and perhaps you to talk about offline. But yeah, I think implementation of some of the parts of 2564, that's still being kind of hashed out internally. So I'm sure Tasha will be reaching out once we have a better idea of next steps on that one.
Definitely a comment at this point, for sure.
Yeah, definitely. Yep, and yes, you can chat later on that. So with that, we'll go to next steps. And let me read real quick. I don't want to cut the meeting short. If anyone has anything else they want to chat about at this point, or if they're feeling like the next best thing would be to just open up like some public comment or some time for you to go back to talk to your teams, to noodle over everything and send back feedback on everything we discussed today. Does that kind of sound like a better plan at this point?
Yes. This is Antoinette from Cambia Health. Yeah.
Okay, so with that in mind, I know we don't have another meeting for a while, but if we could get, I'm looking at September on my calendar. That's not going to help me very much. If we could get feedback from everyone by, and if you don't have feedback, that's okay. But if you have feedback by the end of next week, so close of business Friday, August 15th, then that'll give us some time to kind of download it, think it through, and oh yeah, Antoinette, your hand's up. Go ahead.
You can finish up, Ethan. I keep interrupting you. I just wanted you to wait and then finish, and then I'll chime in.
No, that's fine. I'm letting people interrupt me because sometimes I run. Yeah, so close of business August 15th. I will warn you all I'm out the week of the 18th and a couple days into the next week. So if I don't get back to you right away, it's not anything personal. I just won't be checking email. But yeah, so any feedback, any thoughts, definitely would like to hear them because this was a really robust conversation and there's a lot of moving parts. So any feedback is going to be helpful helping us move forward. So yeah, close of business August 15th. And now, yeah, Antoinette.
Yeah, and and I also wanted the DFR to be mindful that there are so many other rulemakings going on at the same time with another rulemaking. I don't even remember which one it is, where feedback is also due on the 15th. And we intend to provide written comments. So hoping that the DFR would sort of look at other timelines of the rulemakings with respect to their request for that specific rulemaking. I would say that by next Friday is going to be a little tight for me. It's something that I can maybe communicate with you offline, but it's going to be tight, and my actuary is out this week. So just trying to get things, and I know that's more of my problem than yours, but in terms of balancing other requirements and other asks of carriers from other rulemaking, I think that next Friday timeline maybe a little tight for some.
Sure, and that's because we're having another meeting, that's not set in stone, as we won't accept anything else after that. That's just kind of, you know, the sooner we get feedback, the more time we at DFR have, because as you are working many rulemakings, I think the last I heard the number was something like 10 or 11 rulemakings we have to have done by the end of the year. So we're trying to, any tight timelines we're giving you is not, it's just passing on from our own tight timelines. It's just not an ideal situation for anyone. So we appreciate everyone's, patience and diligence getting things done, because it's a tough one. But yeah, if you don't get them to us till the next week, it's not like we're not gonna take them under consideration. It's good to have a goal to shoot for. But again, we do meet September 4th at 1:30. So I would clear your calendars and plan on being at that one.
Thank you, Ethan.
Yeah.
We appreciate it.
Go ahead, Jesse.
Yeah, I just wanted to flag one thing, which is I think it was noted in passing that one of our RAC members, Robert Anir, was unable to make it today. And he is an individual consumer, an individual market enrollee who has been very interested in the rate review process and has submitted comments on rates, and also made some recommendations to us for ideas to improve the process and improve consumer engagement. It's unfortunate he wasn't able to make it, but I just wanted to mention that I believe he will be at the next meeting, and he will likely have some additional ideas that have not been discussed to date. And I just don't want anyone to be caught completely flat-footed by that. It's just that he wasn't able to make the meeting this time around. We will need to continue having the kind of robust discussion we've been having to date, but there may be some new ideas put on the table.
Yeah, thank you, Jesse. And yes, Mr. Neer, he did mention that he'll go back and watch this recording and provide follow-up. So we expect to get comments as well. And yes, it is unfortunate we didn't have him today, but he should be able to make next month's meeting. All right. So anything else before we sign off? Not seeing anything. So thank you, everyone. I know we all have pretty tight agendas and packed schedules and everything, so I appreciate everyone taking the time and the care and thoughtfulness here. And look forward to hearing from you shortly.
Thank you, Ethan.
Thanks, Ethan.
Thank you.
Thanks.
Thanks.